For the last decade and a half, making advancements in the healthcare system in St. Lucia seemed to be a political curse. Government after government tried and failed to meet the seemingly simple expectation that the St. Jude Hospital would be rebuilt. And while each government was working toward failure, the conditions at Owen King EU Hospital were getting worse. However, this government seems to be recalibrating its approach to healthcare, with the appointment of former Minister Damien Graves as the chief executive at the Millenium Heights Medical Complex. Recently, Graves hired Wayne Felicien as acting director of clinical services, and this morning, the health minister introduced Ben Emanuel, former cabinet secretary under the Alan Chastney administration, as chairman of the board, setting the strategic direction going forward.
I'm very happy this morning to announce that the Cabinet of Ministers has agreed to appoint Mr. Ben Emanuel to be the chairperson of the Millenium Heights Medical Complex board.
Benjamin Emanuel, a retired public servant, reached the highest levels of public service, with his last assignment being appointment as cabinet secretary under the former Alan Chastney administration. His appointment, it is hoped, will serve as a sign of the seriousness the government has in addressing what the political opposition has dubbed a healthcare crisis. At the press briefing, Emanuel received a check for $400,000 toward the completion of the fifth wing of the OKEU Hospital, underlining not just the government's commitment to healthcare, but the urgency of the situation.
I am receiving graciously and happily a check for $400,000 towards the construction of the fifth wing of the OKEU Hospital. I guess in a sense it's mixed feelings. Your first task being to receive monies, I think that's good, but you also understand that there will be an expectation of delivery.
Though Emanuel is not a politically charged character in St. Lucian development, his appointment comes in a year when healthcare delivery is closely tied with political maneuvers. After all, the Prime Minister promised there would be no general elections until he has fulfilled the promise to finish St. Jude's Hospital.
Given the urgency of that particular undertaking and the importance of the construction of that fifth wing to ensure that OKEU can deliver the services required by St. Lucians and, of course, users of the institution, will put additional urgent responsibility on the board. So on behalf of the board, I accept graciously, Minister, the contribution as well as the task and challenge of doing what is within our powers to ensure that the Millenium Heights Medical Complex can continue to contribute to high quality of health care that's affordable and that meets the expectation of our citizens in St. Lucia.
The health minister also announced the triggering of a part of the Millenium Heights Medical Complex Act, which allows for the appointment of an inspector for the medical complex.
Subject to subsection 5 and notwithstanding the provisions of any other law, the minister may appoint a suitably qualified person as inspector of the medical complex on such terms and conditions as the cabinet determines. So, the government will activate Part 4 and an inspector will be appointed after deliberations by the cabinet.
Healthcare will almost always be a hot-button issue. However, the government is aiming to take the issue out of the realm of perceived crisis in order to be able to showcase the progress made on the issue in the post-pandemic period. The appointments of Emanuel, Wayne Felicien as acting director of clinical services, and the deliberations over an inspector for the medical complex aim to serve as signals that there is a new direction for improved healthcare in St. Lucia. For Choice News Now, I'm Jason Seafley.